Hi guys, Toby here with the Physio Studio with the first in this video series discussing foot pain. Where in today's episode we're going to be discussing some of the different types of foot pain and how you can begin to identify which structure within the foot or ankle may be causing your pain, which is going to be important later on when we come into why this pain may be here and what you can do to begin treating it. So the first type of pain we're going to begin talking about is the most common, and that is plantar heel pain. This is also sometimes called plantar fasciitis or fasciopathy, though those are less accurate terms and the research is beginning to stray away from those as it's less of an inflammatory condition than we once thought. This pain is usually isolated around the back of the heel, so where your calcaneus or heel bone joins onto your plantar fascia, this thick tissue that runs along from the heel bone here and spreads out upwards into the bases of the toes. The pain in this condition is usually localized around this spot, so around kind of the back of the heel. It can sometimes spread a little to the inside or a little to the outside, as well as often spreading down the foot, following the course of that plantar fascia towards the base of the toes. It won't usually spread into the toes and it won't usually spread above the heel, so if you're experiencing either of those things, this may not just be a plantar heel pain that you're dealing with. The second condition that can often mimic and be quite close to this that we're going to talk about is a Baxter's neuropathy. A neuropathy just means there's a painful condition involving a nerve, and this nerve in particular will cause pain around the medial or inside of the foot, so we're talking a little more the inside of your heel here. This can often still spread along the foot and even along here, mimicking a plantar heel pain, but will often go a little higher towards the inside of your foot here. And it can often present with some other symptoms too. If you've had this for quite a long time, the function of that nerve will also be affected, and you'll find you may have decreased sensation or numbness along the outer side of your foot, and your little toe may begin to weaken and start to drift in, crossing underneath your other toes. Both of these would kind of indicate that you're probably looking at a neuropathy. The third condition we're going to talk about is another nerve-related condition, this one isolated a little more towards the toes. So what we're talking about here is a Morton's neuroma. You may have heard of this condition. Essentially, there are a number of nerves that run down into each of your toes here, and where these nerves join, kind of at the base of the toes, the base of the metatarsals, which are these long bones of the foot, the joining of these nerves can get irritated and become inflamed, and that's where we develop a neuroma. Slightly different to a neuropathy, in that there's usually a bit of a swelling here on the nerve. The way a Morton's neuroma will present is oftentimes on the third and fourth toe, with pain, tingling or numbness radiating up into those toes. It can sometimes happen between the other toes of the foot, but predominantly, most commonly, it will be between that third and fourth. This, as I say, will cause numbness, tingling, pain into those two toes. It will often present as a pain right around here, the base of those toes, and can almost feel like a stone or something in the shoe around this area. Again, what differentiates this from a plantar heel pain or any of the other conditions we talked about is it's more isolated around the toes, and it will present with these tingling, numbness, kind of electric feelings. It won't usually radiate backwards down the heel, so if it is, again, you're looking more at a heel pain or something similar to that. The fourth condition we're going to talk about, still sticking around the toes, is something again dealing with our metatarsals, the long bones of the foot, called a metatarsalgia. Algia just means painful. Metatarsal, as we've discussed, is these bones. So why would we get pain with these bones? So oftentimes, similar to where the neuroma can come from, the base of these toes, the joints here can also become irritated and inflamed. So especially if you're wearing a lot of tight footwear, so often work boots or riding boots, anything that's going to compress the toes together here. It's also more common in women's shoes because they tend to have a more tapered point for the toes. But anything like that that's going to cause compression between the base of your toes can cause this metatarsalgia, this irritation to these joints. Because essentially, if we look at it, if I squeeze these together and then walk, I'm going to be scraping these joints off of each other more than they perhaps like to, and that can lead to a pain either on the underside of the metatarsals here. It could also sometimes spread into the top side of the foot, and again, this can sometimes refer a little bit back or a little bit down into the toes. So I hope that's provided a little more clarity on what some of the types of foot pain mean and what they could possibly be coming from. In the upcoming videos, we're going to talk about what could be causing these, and you're going to see a lot of common themes that you might want to address.